I'm Dr. David Hill, and today we're going to be talking about laughing incontinence in children. Now, let me be clear, we're not laughing at incontinent children. That's a very common issue that we deal with and a very serious one. However, children who laugh, you may notice, sometimes pee on themselves. Is that normal? And why does that happen? Well, at some point it often is normal, if it only happens rarely, if it happens with extreme laughter. Why would that happen? When you laugh, the pressure inside the abdominal cavity increases. That pushes on whatever urine's in the bladder, and sometimes the muscle that keeps urine in the bladder, called the urinary sphincter, is not strong enough to keep a little bit of urine from leaking out. That said, usually the amount of urine that leaks out should be relatively small. The child should be able to get control again before he loses the entire contents of the bladder. Now, if the incontinence is occurring without just laughter, maybe it's occurring when your child stands up, especially in girls, they may be lying down or seated and then they stand and they wet a little bit, that can be due to reflux of urine up into the vagina. If there is new incontinence, if a child who had been using the potty successfully, holding it in, making it to the bathroom, suddenly has a frequent problem making it to the bathroom, suddenly is losing continence with some regularity, that always deserves an investigation. It could be a urinary tract infection, it could be a problem with the bladder or the nerves that supply that part of the body, but your doctor is going to really want to see that and help you figure out what's going on. That said, if your child has a fit of giggles and suddenly ends up with a little damp underwear, relax, it's probably normal. Talking about laughing incontinence in children, I'm Dr. David Hill.